Hey friends, welcome back to my channel for another video. If you are new here, I'm Kalesha and I am a registered dental hygienist. And as you can see by the title, today's video is a little bit different. I've never talked about this on my channel. However, today we are going to talk about it, and that's shadowing. So if you don't know what shadowing is, it's when a hygienist allows a student or someone who's interested in the field to just follow them for the day, to get a feel of the land, to see what we do day to day, to see if they want to actually pursue this career. So today's video, it'll be kind of similar to the rest. It'll be vlog style, but I have a helper today and I'm gonna take advantage of it. Little does she know, it's a surprise. I did not tell her, but she was here yesterday and she watched me work a lot. But today she's gonna get her hands dirty, and not technically because she'll have on gloves, but y'all get the point. So I have Alexia here with me today, and she just recently graduated from dental assisting school about what, 2 weeks ago, 3 weeks ago roughly. Right. Well, yeah, a month then. That's a month, yeah. So like a month ago. So she is an assistant. But she wants to become a hygienist. So she's here. She was here yesterday and she's here today. And she's just getting a feel of the land. She's also been watching some of the other stuff being done in the other operatories, but primarily she's been in here because her interest is, of course, hygiene. So for any body out there who's a high school student, you're in college and you're just thinking about, you know, this may be a career path for you, I highly recommend contacting like your local dentist to see if there's a hygienist that's willing to let you just walk around with her for the day. You don't have to do anything. You can just, you know, walk around, observe, and ask questions, because choosing a career is important, okay? And you want to be sure that you like it, because there's something you're going to be doing for a certain period of your life. I don't want to say forever, but a certain period of your life. So you want to make sure that you love it and it's something you want to do. So with that being said, we're gonna go ahead and get into today's video. I have already seen my 8 o'clock patient. Let me go over the schedule with y'all. So I do have full schedule this morning. However, I don't have a 1 o'clock, and my day ends at about 4:40-ish. So we'll see if everyone actually comes, because y'all know I go around here. We get cancellations and we get no shows, okay? That's no secret. However, I just finished my 8 o'clock and I'm ready for, well, I'm waiting on my 9 o'clock, but I did not touch my room, as you may see. So you're gonna clean it today and I'm gonna watch and just kind of talk you through it. So do you remember what I was doing yesterday? We're gonna let my girl do her thing today, because this is something that assistants will do. They have to break down the rooms, set them back up. Whether you're a hygiene assistant or a doctor assistant, it's really important that you know how to disinfect the room. If you'd like, I can talk you through the first one and then you can do your own, because the patient just got ready, so we gotta break this down real quick. So usually what I do, I just flip this inside out, because I just put that on there this morning. So I flip it inside out to be able to use it again for one more patient. Yep. And then I go ahead and take that straw off. Yep. And then I go ahead and take that, yep, you kind of push that little, this right here, the second part, push it in and then pull wide. Yep, drop it right there and get the paper and stuff off. Paper and gauze, those 2 pieces of gauze that go in the trash. You just ball it up, trash it. Then I get the wipe and I start over there where the straw, because that's really the only thing I touched, was that little small suction. Yep. And then I also be touching those buttons, so kind of like wipe those. I wipe the armrest. Yep. Yep. And since you did the whole chair, you can throw that wipe away, because this like they booty. Then get another wipe. And then I just wipe the handles, of course, because I be grabbing. Yep, you can take that up, actually pull it out. Yep, and wipe it real good and wipe down in there as well. And then sit it back in there and wipe that handle right there. And wipe the other handle, because I had to grab those. And then I go ahead and get, B-up chain, wipe that real good, and I just kind of scrap it around there for right now, but we'll pick up on that later. Then I get that, I wipe it real good, and I just kind of like sit it over there in that little basket till I set back up. And then I pick the instruments up, all up, one hand, and then I wipe the tray with the other hand. And just wipe it real good. Yep, and then we're gonna go to sterilization. You can drop that wipe in the trash, and we're gonna go to sterilization. Alright, so what we do is grab that and kind of wrap it around all those instruments. Kind of wrap it like a scrunchy thingy. Yeah, that'll do. Yep. And so, just throw it kind of like, squeeze it in there. And so you can sit it inside of there. And then you can turn it on. It's like a little button. Twist it.
Which way?
Right. Yep. All right. Just in here. You can take those gloves off and trash them. And then we're going to sanitize and set it all back up. So then you put some hand sanitizer on. Yep. And then we're gonna set it back up. So me, I already have some like quick and easy, just ready to grab. So you can just grab that, put the straw on, and then bring the whole white paper to the tray. Yep. You can grab the instruments, be up there. Just grab a pack. Yep. You don't have to open them, no. And then this here straw, as I noticed, don't even have a top suction point. So we're going to throw that away and get another one and put it in there. And that's pretty much it. All right, so room is set up. Now I'm going to go ahead and get my next patient back. She's super funny, but it won't take long because, she doesn't have any upper teeth. So I just have to clean her lower, but her gums are always really sensitive. So I always start off by putting a little topical on. So I'm gonna go ahead and get that out. So I just grab a gauze or two, and then like 2 cotton rolls. And we're gonna put this on her gums before we get started, let it sit for a little while, and then we're gonna start cleaning. And then after this patient, me and Alexia will have a little time to sit down and chat with y'all. So stay tuned for the rest of this video. Okay, y'all, so we got everything out to make some patient bags because I'm literally almost out. So we're just gonna chit chat a little bit while we make these patient bags. But of course, first I'm gonna show her how to do it. So I literally just take the toothbrush first and kind of open it up. Take the toothbrush, put in there, grab the toothpaste, and because I'm a little OCD, like wherever the little card thing is, that's the front. So I like the toothbrush to show. I like the name of the toothpaste to show. And then I like the name of the floss to show. So at the end, it should look just like this, so they know exactly what they're getting, okay? And then you just put it in a drawer and you just kind of sit it up here. Yep, so she made her first patient bag, and we're gonna just go from there. So, first question I wanna ask, others may be wondering too, and I usually have the question as well, like why did you decide to do assistant first? And I know it'd be different for everyone, but I want to hear why you decided to do, assistant instead of just going right into hygiene.
Okay, so I'm gonna give y'all a little bit of my education background because it's all over the place. So I graduated high school in 2020, and then I went to Hygienist. I was initially supposed to go there for nursing. While I was there, I started to kind of like second guess my career field. So I went ahead and graduated from Hygienist in 2021 with my associate's degree. So I had a little break in between there to kind of think about what I wanted to do. I still had my mind set on nursing, and when it was time for me to apply, I was just procrastinating and missed the deadline.
Yeah.
So I was gonna do medical assistant after that, and I kind of like talked to my mom about it, and I didn't want to like do something that I wasn't happy.
Yeah.
And I didn't want to get up every day going to a job that I did not want to do or did not like. So I changed to dental assistant, and my best friend kind of encouraged it. So she found a program that was only 13 weeks. So we enrolled in that, and we just finished that. And assistant kind of like, it gives you a start to see if there's something that you really want to do. So here I am with Kalesha.
Okay, so from there I kind of gathered that you kind of wanted to see what the dental field was like.
Yeah.
So assistant was like that first step. Yeah, that first step. And then once you're in the door a little bit, you can kind of, you know, even as you work as a hygienist, you can then watch, you know, like the hygienist. I mean, even as you work as an assistant, you can watch the hygienist. You can, you're learning stuff as far as like all the assistant tools, how to help the dentist. And then as you sit and watch the hygienist and kind of help her, and you decide to go to hygiene school, finish hygiene school, now you're like an assistant and a hygienist, which I think is like dope. You know, I think that's perfect, you know, to be able to do both. Because that just means you're well rounded. That just means when you get hired, you can tell that employer, like, I've graduated assistant school, I know how to be an assistant, and I know how to be a hygienist. So you just kind of like 2 in 1.
Yeah.
So I think it's perfect. So yeah, that's good. That's good. Okay, y'all, so we are back from lunch. I've actually seen my 1 o'clock patient already. Does not look like my 2 o'clock patient is going to show up because it is well after 2 and his appointment was at 1:50. So safe to say he's not coming. Also, my 2:40 patient is not confirmed. He's a new patient, so he may not show either. And then I don't have another patient until like 4. So before that new patient comes or not, we're gonna go in sterilization, because another thing that's very important for both hygienists and assistants is to know how to clean instruments properly and put stuff away and all of that. So we're gonna go in there, clean out the ultrasonic to help the other hygienists and assistants, and just make ourselves useful in this downtime that we have here, and just show Lex some stuff around the office and all of that. So let's go. So we got a few instruments in here. So first thing we're gonna do is, cut the water on. She already know what to do because we done did this earlier. So let's see if she was paying attention. Okay. All right, and she only has to do the same thing for 2 more. Okay, so we ducked off to the lab somewhere kind of quiet, although this is a dentist, so you still may hear some sounds in the background. But I wanted to ask her a few questions before we wrap up today's video. So tell us like a brief, just something about dental assistant school. You told us that it was 13 weeks. How was like the program, the study, the workload, and do you feel like you came out of it like prepared to like come into the workforce and work?
Okay, so the program that I was enrolled in was online, most of it because of where I live, and then we would go in sometimes to get hands-on. It was 13 weeks, but you had about 17 modules. that you had to finish before those 13 weeks are over.
Wow.
So it was kind of crammed a little bit. It was a lot of videos, a lot of like online labs and stuff like that. It was pretty fun. It was pretty cool, but it was better when we went in the class or whatever like that. I feel like, cause I'm kind of a hands-on learner, so they didn't really like. So
that was kind of my next question too. Like, do you think, like, say you're a subscriber, she's a subscriber, she watches my channel, and she likes the videos. She told me she liked the videos, she found them helpful. But being that you've come and you have like it's much better.
It's much better in person than watching videos.
So that's another thing I want to say, and I kind of mentioned it in the beginning of this video. If you have a chance to shadow, please go and shadow in person. I know these videos seem like they can be a lot. They are helpful actually, but it's nothing like actually putting your hands on things and like learning what things are, seeing it in use in real time. So if you all have any way that you all can shadow, contact somebody, please do, because you've heard it from a shadower, future hygienist yourself, that the videos help, but it's a lot better to be in person. So yeah. So what do you rate today, or your experience from yesterday to today? You kind of just observed yesterday, but today you kind of got to do a little thing.
What's the scale?
So what do you think? Do you still want to be a hygienist? Are you kind of like on the fence? Like, what do you think? You like
it encouraged me more. Okay, so good. 10 out of 10, highly recommend.
All right, y'all. Well, we're gonna go ahead and wrap up today's video. I hope you all enjoyed. I have a few more patients if they show up, because y'all already know how I go down around here. But we're gonna go ahead and wrap up today's video. If you all like this video and you want to see more like this, just give it a thumbs up. Be sure to subscribe, hit that bell next to it so that you're notified on my next upload, and I'll see you then. Bye, Hygienist.